issue of right ventricular versus biventricular pacing in patients with low ejection fractions now seems settled. Most of us certainly agree that biventricular pacing should be considered if the EF is less than 30% and the QRS width is greater than 0.12 seconds. However, biventricular pacing is a complex procedure and a question must be raised. Can left ventricular pacing alone avoid the deleterious effects of right ventricular pacing alone? Now in circulation, there is a report of a multi-center double-blind crossover trial comparing the effects of LV and biventricular pacing on exercise tolerance and LV remodeling. Patients were randomized to LV followed by BiV pacing or vice versa for consecutive 6-month periods. Exercise duration, improvement in LV ejection fraction, and reductions in LV end systolic volume were all similar in both groups. So there appears to be no difference in treatment strategies. However, there is more interesting data from this trial having to do with patients who did not respond favorably to either BiV or LV pacing. Overall, 31% of LV pacing non-responders improved with BiV pacing, and 17% of BiV non-responders improved with LV pacing. The takeaway message is that LV pacing is not superior to BiV pacing, so BiV pacing remains a good choice for your heart failure patients with a wide QRS duration. However, non-responders to BiV pacing may respond favorably to LV pacing, suggesting a potential role as tier therapy. I'm Peter Block, and this is a CardioSource Heart Minute.